Thank you for joining us for day 2 of our 4th annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the key to accelerating innovation. My name is Richard Knight, and I have the pleasure of serving as president of the American Association of Kidney Patients. Since the Global Summit's inception in 2019, I have been pleased and quite frankly astounded to see how much this patient-led international event has grown. In 2021, in over 80 countries tuned in, and after an initial report I received this morning, the 2022 event is on track to exceed that. I would also be remiss if I did not recognize and thank our good friends and allies at the George Washington University School of Medicine and Health Sciences for their partnership in this joint venture. Under the direction of Dr. Dominique Raj, a Global Summit co-chair and director of the Division of Kidney Diseases and Hypertension at George Washington University, AAKP and GW have been able to develop a powerful platform that drives care changes and connects experts worldwide on issues related to patient consumer choice and access. With that said, I hope you join all the sessions on day 1. If you were unable to do so, or if you want to revisit one of the many fantastic presentations, you can access yesterday's program on demand via the Agenda tab. All Global Summit sessions will also be available on demand post-event through AAKP's social media and our YouTube channel. Yesterday, we were honored to have Dr. Raymond Van Holder, President of the European Kidney Alliance, share about his great work to prioritize global kidney health, and Mr. Jack Fisher, Technical Officer for the Deputy Director General's Office of the World Health Organization, to discuss kidney diseases as a global priority. We also heard from U.S. government agencies, including AAKP's good friend, Dr. Robert Starr, at the National Institutes of Diabetes, Digestive, and Kidney Diseases, National Institutes of Health, Melissa Flackman, and Ann Doderlin, with the congressionally directed medical research program through the U.S. Department of Defense. Our good friend Dr. Paul Polinsky with the U.S. Department of Veterans Affairs, and Mr. Tom Duval from the Center for Medicare and Medicaid Innovation, Centers for Medicare and Medicaid Services, to name just a few. Each of these individuals and their respective agencies is doing great work to make kidney health a top priority in the U.S. and, as we see, across the globe. And we are very honored to continue to work alongside them as AAKP advances our Decade of the Kidney Initiative. Our panel showcasing industry efforts to advance kidney patient care across the world was unrivaled. These industry leaders gave fabulous presentations on how private sector is leaning forward and investing in advancements to disrupt the status quo of kidney care and develop therapeutics, biologics, and devices that align with patient needs and preferences. We know that there is still a lot of work to be done, and we are pleased to see the commitment and dedication of these companies all over the world. Closing out today, we had additional presentations on the COVID pandemic, lessons learned for patient safety, and long-term management of COVID, as well as monitoring the kidney allograft in the 21st century. As knowledge and treatments have evolved regarding COVID from what we faced in 2020, we must remain ever vigilant as a community, that is, and serves some of the highest at-risk patients. A big thank you goes out to Dr. Michael Osterholm for his special presentation on this important topic. But most importantly, yesterday, we heard from patients. We heard from patients around the world. India, Canada, Nepal, Germany, and Australia, as they shared with us how kidney disease has impacted their families, how they advocate for improved patient care in their home countries, and the importance of patient engagement in research and innovation to develop more choices and ensure access to these treatments. We ask everyone participating in today's program to share with us your thoughts on the presentations and what innovations that you are most excited about. You can do this by visiting the discussion board on the event platform. You have heard AAKP's motto, patient voice, patient choice, and we stand by that and appreciate all who exemplify this. As we move into day 2, we have an equally great lineup, and I'm really excited to hear about today's presentations on home dialysis, artificial organs. The future is certainly here. And as we continue to recognize the decade of the kidney, we ask for your continued engagement. Before we begin, I'd like to thank our sponsors: Novartis, Gold sponsor; Kimbo Biotech, Silver sponsor; Horizon Therapeutics and Travere Therapeutics, Bronze sponsor; Mallinckrodt Pharmaceuticals, Patron sponsor; and Talaris Therapeutics, supporting sponsor. And we greatly appreciate their support of this year's event.